I can't think of anything more interesting to investigate in the universe than the human brain. I mean, there might be a few other things, the origin of the universe or how the universe is going to end. There are some other really important questions. But on the day-to-day, everyday life level, there cannot be anything more interesting to me than trying to figure out what it is that makes humans human and how the human brain works. And I've always been interested in that kind of question. The whole world of neuroscience has evolved to a point now that there are tools that let us really ask hard, interesting questions about the most subtle things that you can think of in how the brain works. And so epilepsy is one of the situations where we get to deal with how a person thinks and how the brain works and what makes them move and what makes their language work. And we have ways, we've developed ways in standard surgical planning to try to understand those things to a high enough degree that it's safe to think about taking out tissue in, say, the left temporal lobe, this area, if that's the area that is causing seizures. The operation that we're doing in a lot of these kids, which is a way to map where the seizures are coming from and also where the function is to put a grid, and this is literally a plastic grid with little electrodes in it, over a particular surface of the brain. And that gives us the opportunity to get a very high time resolution and a pretty good space resolution of things happening in very specific areas of the brain. So we can go through now and for over a decade we've been working on memory and doing tasks where we ask people to remember things, and we can look at what areas are involved. And lately we've been able to move into other areas. So we always wanted to do something having to do with emotion, because emotion is very important in people with epilepsy and in life in general. And working with Roz Picard and her group at MIT, where they actually have the ability to look at a videotape of the face of a person and interpret what the facial expressions seem to be saying, and then we can try to correlate that with the brain activity. Gabriel Kremen, who's a collaborator here at Children's, has a great experience in looking at how the brain perceives objects. So he will show our patients movies and show them pictures and try to correlate exactly what areas of the brain are involved with identifying things. But even more importantly, are there areas of the brain that are involved with one kind of discrimination, say picking out a particular face or a particular person, versus other parts of the brain which may have to do with other ways of understanding a visual perception. So it really tells you about how the person is seeing the world.